personalized medicine and drugs. I mean, administration of the drugs, different kind of drugs. When you are going to prescribe a drug, usually you need to know about, for example, gender, weight, race, or concentration of the drug and the disease, and many different information to prescribe the drug. One of the things which in future you need to know about the drug, I mean for prescription of the drug, is genetic. At the moment you don't care about genetics when you prescribe the drug, but in future definitely you need to know about this one. That's personalized medicine. When you are speaking about drug, you speaking about something such as, do you know maintenance of the drug or dosage of the drug related to which parameters? Do you know?
Weight and gender.
Weight and gender. Physiologically related to what? I mean, how drug, let me ask a question clearly. How does the drug, when you have a pill, how does the drug clear from your body?
Digested by liver.
Metabolized by liver. Metabolized by enzyme in the liver. Other way.
It's got by urine.
Kidney. Clear by kidney from the blood. So two ways. One is kidney, another one is liver. Do you think our liver works, our liver of us, work exactly the same? Enzyme in my liver is the same as your enzyme? No. Definitely is different. So, is it possible to have different clearance, different metabolizing of the drug in our bodies? So, is it possible to prescribe different amount of drugs depends on our liver? Yes. But you must know about the enzyme in your liver. But we don't know.
No, we know.
You know? You don't know. We don't know how enzyme works. How do you know? If you know the genes, you know the RNA, you know the protein, you know the function. Understand this way? This way is very clear. If you know the DNA, you know the function. That's easy. That's easy. This is very interesting numbers. Very interesting. Can you read this one? 100,000 Americans, not Iranians. Maybe Iranians is more. Americans die annually, annually, and 2 million are hospitalized due to adverse reaction to the medicine. Do you understand what that means? Means we kill at least 100,000 people in the US. In Iran, much more. Understand? We kill them. Yes, I don't say. We kill the people. To be honest with you, I don't want to say it is from America, not from me. That's from the US, not from me. So just imagine how many people die, not hospitalized, die to our prescription. Understand? Is it important or not? We don't treat people, we kill people. Imagine in America with a lot of rules and good drugs and so on and so on, 100,000 annually per year. They die annually. I am sure in Iran is more. I am sure. Yes. When you pass, do you know cemetery?
Yeah.
When you pass the cemetery, many people there are from our world. many, to be honest with you. So, good job in future. Okay. How we can choose the safer dose? How we can choose the safer dose? This is very important. How we can choose the safer dose and how we can improve and actually make development of exact drug for exact person. Exact drug for exact individual person. That's the best. At least we don't kill them. We don't kill them, at least. At least. So, in this situation, we need design drug. Design drug for individuals. When I saw this picture, it was very, very important picture for us. Do you know hypertension drugs?
Yes.
Yes.
Or no?
Yes.
10 to 30% hypertension drugs, it doesn't work. Do you know heart failure drugs?
Yeah.
15 to 20% of these drugs doesn't work. The only work is in my pocket. Money in our pocket. That's it. Look at, do you know antidepressant drug?
Yes.
Maybe you use it. I don't know. 20 to 50% doesn't work. Do you understand? You don't believe it? Believe it?
So why the drug doesn't work?
Because you are different from me.
Yeah.
In your country and in our country, we go to the doctor, the office doctor, we go there and doctor prescribe a drug for me.
So,
And the drug doesn't work. Due to
so
medicine.
you need to another drug.
No. Oh yes. Just by chance, not by genetic. Just by chance, according to try and error. Do you know try and error? Do you know try and error? That's the first doctor. I go to the doctor, prescribe something for me. He said, it didn't work. This doctor doesn't know anything. Yeah. Go to another doctor. Is it right? And another doctor prescribed for me another drug. And works. I say, this person is intelligent. No, he is not intelligent. My body is different. This doctor is saying, write everything, it works. This doctor is the best. No, it's not. It's just try and error. Do you understand what I mean?
Yes.
So how I can...
You can see in your country, we can see in our country, everybody is there. Not here, even in the US.
How can I make the true drug for the person?
Personalized
So how-
medicine. Yes. That's the result. You got the answer. It is the answer. How you can choose the best one here? If you know the sequence, if you know the DNA, you know the function, you choose the best drug for that one. It is just try and error. How many kind of antidepressants we have? Many drugs. One works for me, one works for you. Because our genome is different. Because our liver is different. Because our kidney is different. Am I right? It's very easy. It is not only for drug. Do you know what is that for? Do you know alcohol? I don't drink alcohol, but do you know alcohol?
Yes.
Very well. Good.
Sometimes drink.
Sometimes you drink just only one glass of alcohol, you make a drunk. It make you drunk. But sometimes you drink a bottle of alcohol, nothing happened. Do you know why? Because in your body we have enzyme called alcohol dehydrogenase. Alcohol dehydrogenase. You understand what I mean? Destroy alcohol. This enzyme in your body work fast and destroy alcohol. Eliminate alcohol from your blood quickly. For me, doesn't do that. So one glass, half of the glass make me drunk, but you drink a bottle of alcohol, nothing happened. Because your enzyme is much stronger than my enzyme. Understand? Understand? It's not only for alcohol, it's for many things. Many things. Many foods. Many things. Understand what I mean? So, and asthma drug, 40 to 70% doesn't work. It's a lot. It's amazing. It's just beta 2 antagonist. Maybe you passed pharmacology and you can understand. So what I want to say, each part of the drug, according to your genome, can be managed for prescription. For each drug. And future medicine is personalized medicine. At the moment is try and error medicine. Understand? Try and error medicine. So, in this situation we have pharmacogenomics. Do you know genome? Pharmacogenomics or pharmacogenetics. Pharmacogenomics or pharmacogenetics we have. What this means, pharmacogenomics means the benefit of new disease inside and new drugs and medicine that we have. I want to give you just 2-3 examples and finish this part. Do you know leukemia?
Yes.
Leukemia is a cancer, blood cancer. Treatment of leukemia, one of the drugs which we use for treatment of leukemia is thiocorin methyltransferase. The enzyme works with this enzyme. That the drug is 6-mercaptopurine. 6-mercaptopurine. This enzyme can metabolize this one. You remember some enzyme in our liver can metabolize the drug. This enzyme, methyltransferase, can metabolize this one. So, how many allele do we have in our genome? 2. Is it possible one of the allele doesn't work, has got mutation, and the enzyme work half? One, we have 2 alleles, one has mutation, doesn't work, DNA, RNA, protein function. You remember? Okay. So we have two alleles of DNA, one doesn't work because of mutation. So we have half right DNA, half RNA, half protein, half function. Is it right?
Mm-hmm.
If we have just one mutation. If we have two mutation means this enzyme doesn't work. Exactly, deficiency of the enzyme. So what happened? If the enzyme, we have deficiency of enzyme, this drug can stay in our body for a long time. Do you know chemotherapy?
Yes.
Chemotherapy is some sort of drug which can kill cells. If the drug stay in our body, kill ourselves. Not the cells, all cells. Not the hematopoietic cells, cancer cells. They kill all cells. So, for the person has got problem, not function of the drug, not function of the enzyme, not function of enzyme, we have to prescribe less drug or high dose of the drug. Which one?
Yes.
Less. Because if we prescribe high dose of the drug, it can stay in our body for a long time and kill our cells. So in this situation, we have to prescribe less. Is it useful to know about the genetic of the enzyme before prescription?
Yes.
Understand?
Yes.
It is important. In this situation, we can say, for example, 500 milligram, 100 milligram, or 10 milligram. How much you have to prescribe? 10 or 100? 10 times difference. So, another example. It was one example. Another example is warfarin. Do you know warfarin?
Yes.
What is that for?
It's anti-coagulating drug.
Anticoagulation. When they change the valve in the heart, they use other, not natural valve. They change the valve. For example, they use a steel valve or valve from, for example, mitral or tricuspid valve from pig. They use pig valve or steel one. They use warfarin to prevent coagulation, to prevent clot. Warfarin has got two polymorphism can change the metabolization of the drug. If, look at this one, if we don't check these two genes polymorphism on gene CYP2C9, which is in the liver, cytochrome C. Do you know cytochrome C? Yes, it is. And another one is VKORC1. That's two genes with different polymorphism. If you don't check this one, the function of the warfarin can work 10 times more. Do you understand what I mean? If you prescribe one drug, one pill, for example, this pill can act 10 times more. What happened? Means overdose. When you do overdose, make bleeding, brain bleeding, and other bleeding, and the result is death, fatal. If you use one pill, but the person destroy this one quickly, It is underdose, makes thrombosis and fatal. You understand?
Yes.
In the US, if you don't check this one, in these two, and prescribe warfarin, if something happened to the patient, they sue you. Do you know sue you? Take you to court. Sue you a lot, $1 million. So a lot. So many polymorphisms should be checked. So FDA, Food Drug Administration, they check the test variation of these two genes before prescription of warfarin. And many papers showing this one to check the warfarin polymorphism. You can see New England Journal. It is there. Also, you remember I showed you for array sequencing and GS and so on. So in this situation, that's heart and vascular system, they check warfarin adverse reaction is this one. If we have polymorphism, we have to check it. For example, saying the dose should be less. Here it has been written the dose should be less because they check different polymorphism. Is it clear? It's so it is not only for warfarin, it is also for, do you know that one? These two drugs? You don't know morphine?
Analgesic.
Yes.
It's analgesic.
Morphine. That's
Yeah.
heroin. Morphine.
If you use it like when you adapt it to morphine,
Yes.
but it's a medicine.
Sometimes it's medicine, sometimes it's drug.
Yeah.
Yes, both. But for these two, even for codeine or morphine, also there is some genes and polymorphism can change the reaction of that metabolization of the drug. What this means somebody use a little bit for any kind of reason, for drug as a drug or as a medicine, they use this one a small amount, but the reaction is high. For another person use a small amount, but there is no reaction. Understand? Because of the polymorphism. Because genome is different. Because these two genes, CYP2D6, which is cytochrome P50. You know cytochrome P450, cytochrome C. So polymorphism in this gene can change metabolization of the codeine or morphine. What I'm giving you now, just example of different drugs. Another drug is Plavix. Plavix is used a lot.
My mother used it.
Use it.
Yeah.
Okay. Do you know how many drugs already sold in the world? $2.3 billion of this drug already is market of this drug in the world. So many people use it. I want to show you many people use that one. And do you know it is very critical before that to check CYP2C19 and these genes. Why you use it? Your mother used that one. Just try and error. By try and error, not checking the DNA. Understand?
Yeah.
You are lucky, or your mom lucky. Otherwise, bleeding or clotting.
Yeah.
Understand?
Yeah.
Okay, good luck. I don't know, just my luck. So you have to check different things. For therapeutic strategy, you know therapeutic strategy. For therapeutic strategy, you must, before treatment, check the dose for therapeutic. You have to check the dose. How do you check? Very small piece. Thank you very much. Very small piece of instrument, like that. Half of this. You put the bleed, just a drop of blood, and check it here. Nowadays it's easy. Still it is expensive, but in future, when you graduated, I am sure this one become much cheaper than now. Much cheaper, definitely in future. Just I am giving you some example. Another example is this drug. The name of the drug is trastuzumab. It is monoclonal antibody. I will tell you tomorrow about that. Teratogens is a drug, it is monoclonal antibody. It is teratogens. This one. This is a receptor on breast cancer. Do you know breast cancer cell?
Yes.
On breast cancer cell is a receptor. If this receptor with this growth factor, this is growth factor on cell on breast cancer called HER2. The name of this one is HER2. And this is growth factor. When growth factor sit here, it makes this one. It makes the cell divide 2, 5, 6, 7, 8, 9, 10, and go for division. These growth factors stick to receptor and make dividing in cancer cell. What is this one? That's monoclonal antibody. Stick to it, this receptor, and growth factor cannot stick to that. Understand?
Yes.
This one cannot stick to that. So, stop division. Stop division of the cell. There is no division in the cell. Which cell? Cancer cell. So, if, look at this word, if receptor, the cell, cancer cell, has got this receptor, you can use this antibody. Otherwise, you cannot use the antibody. Understand? Is it important to know before that? Important to know the cell has got receptor or not?
Yeah.
Otherwise, you give this one, but there is no receptor. Do you know how much is the price of this drug?
$1 million?
In Iranian, to money is about 300 million tumans for each week, per week. 300 million tumans per week. But you prescribe this one, there is no receptor. You lose your money. Understand? You lose your money.
So cheap.
Sorry?
So cheap.
It's not cheap.
No, so cheap.
Oh. So you have to check it before. Another drug, another thing. Many drugs in cancer, you have to check before. Because the cancer treatment is very expensive. Many drugs, you should check it. And many other drugs you can see. You don't need to memorize these drugs, just to know. You don't need. Now this is what for before this. We need law. I am sure we don't have them. It is the non-discrimination rule. Do you know discrimination rule? Means if I have the problem, for example, do you know BRCA1, BRCA2?
No.
No? BRCA1 and BRCA2 is a mutation can cause cancer. 80% if you have this one make breast cancer. If you have a female breast cancer, male cause prostate cancer. If they have BRCA1 or BRCA2 mutation. BRCA1, BRCA2 cause breast cancer. Do you know Angelina Jolie?
Yes.
Okay. You know. So she had mutation here. That's why remove the breast, ovary, and uterus. Remove that. Why? Because about 80%, it makes 80% cancer. 80%. Change the lifestyle. Oh, she had many children. 5, 6, some children. So that's why remove that one. Because she knows if she wants to keep breast or ovary or uterus, maybe 80% become cancerous. Understand? So in this situation, remove that. Now, if you have information about, for example, you have BRCA1 mutation, and I say to insurance company in the US, not in Iran, Iran is not important. In US, if I say, okay, he has BRCA1 mutation, no insurance company insure you, and I have to pay for him. I have to pay because he can sue me. That's non-discrimination law. That's non-discrimination law. It means if I know something about your DNA, your genome, I have to say just only to you, not anybody else. Not your wife or your husband or your children or your family. Understand? Because it's very important. It is much important than your money. Because your body is not your money, it's your body information. So many companies invest on sequence of different human. 5.7 billion. Do you know Roche company? It's a big company for produce drugs. It spend a lot of money for sequencing DNA to know about the function of the drug. And look at this one. A lot of money paying for personalized medicine. A lot. Okay, let me go to another one. I put this one for you in here, genetic. The slides. Okay, let's go to another subject, another thing. Congenital malformation and teratogens and twins. Uh, when we are speaking about genetic, definitely we are speaking about this an abnormality. When a child, baby, born, look at this one. This in the first year of life, this at the first year to 9 years, this at the 10 years to 15 years. How many percent? 25% this in the first year. Do you understand what I mean? 25% this with abnormality. If somebody has got abnormality, has got any kind of abnormality, 25% will die in the first year. 20% will die between first to 9th year. 70% will die between 10 to 14 years. Means teenager. Childhood, teenager. In 25%. I mean, that's the death results of major structural abnormalities. So, is it important to see about abnormalities?
Yes, excuse me, about the percentage. Is it related to the child abnormality or the parents' abnormalities?
Child.
Yeah.
If somebody after birth has got abnormalities, any kind, I will explain about abnormalities.
In DNA?
No. Abnormality may be caused by DNA. I will explain. Maybe. Just abnormalities. Imagine abnormalities.
In which part?
The ear change, the nose change. I will show you which kind of abnormalities. Any kind of abnormalities, look at that. Approximately 50% caused by genetic. If somebody born with abnormality, just close your eyes and say 50% caused by genetic. Look, it means genetic is important. Genetic is important. When you have abnormal child, when you see abnormal child in your job, definitely you see many child, many. So when you see abnormal child, think 50% is it caused by genetic. Understand? You have to refer that person to geneticist as a medical doctor. So approximately, but some of them with mortality 80%. Infants this, you know infant? Yes. Infant this, 3 to 5% of all births result in congenital abnormality. It means we have 1 million births in Iran. How many abnormal do we have? Imagine 5%. For example, 5% of them are abnormal. How much?
50,000. 50,000.
A lot. Understand? A lot. It means in your job, when you are working as a medical doctor, definitely you see abnormal child, abnormal infant. Understand? It is when I am saying in Iran, it's the same in other countries, more or less. birth defect in Farsi is not, but birth defect. What is birth defect? Birth defect is a condition present at birth, physically, intellectually, mental retardation or something, or developmental, which I will tell you. This is called congenital malformation. So birth defect is sort of congenital malformation. It's the same word. Different kind of birth defect, different kind of malformation. One is major abnormality, anomaly, major anomaly. Another one is minor anomalies. Some are normal variant. Look at these three here. The first one, do you know cleft lip?
Yes.
You have seen that. So, in this situation here, in this one, and in this one, which has got encephalopathy. Anencephalopathy means the head is small. So in this situation, you have to look at this word. You have, as a medical doctor, you have to refer this major abnormality, major anomaly to surgeon. Understand? You have to refer this person to surgeon. Means major anomaly. For the minor anomaly, you don't refer to surgeon because you have time to see what happened. Such as these two, for example, here you can the Syrian crease here. That's anomaly. But it is not major. You don't need to refer to surgeon. Or slanting eye. The eye is like that. So in this situation, you don't need to refer this person to surgeon. But it is anomaly. But it is minor anomaly. And some variant. Do you know hydrocele? Do you know scrotum?
Yes.
Sometimes baby born and in the scrotum we have a mass in the scrotum, mass, because the fluid here, the fluid in the scrotum should be, before birth should be removed from scrotum, should be removed or absorbed. But after birth is still there. Nothing happened. After a few times may be removed. But it is sort of normal variation. Or this one, syndactyly. Do you know syndactyly? Not only in toes, maybe fingers. So it is sort of normal variation. So we have different major anomaly, we have normal minor anomaly, and different variation. Where are they in this variation? Some of the variation, or mainly are in cardiovascular, central nervous system, or gastrointestinal. We have different variation. Okay. It is very important to know some when you want to refer, as a medical doctor, when you want to refer the baby to a specialist, or you want to refer this baby to geneticists, or you want to refer this baby for some tests, you must write down the name of the abnormalities. You understand what I mean? If you make a mistake, you lose your reputation. Do you know reputation? If you write it down by mistake, you lose your reputation. Definitely. In my language, you can't say it. You fail. You know? So, reputation is very important, especially for medical doctor. You must know about that. When you want to, for example, if the problem is, the abnormality is with development, you say malformation. Look at that. Malformation means related to development, tissue development. The abnormality related to tissue development is if it is in second or third trimester and caused by mechanical stress. Look at that, mechanical stress. It is deformation. Malformation is such as you can see here, cliff lip or spina bifida. They are problem in development. Deformation, it is due to physical or mechanical stress, such as collapsing. When the baby is in the tummy, they cannot, the amniotic fluid is less. Amniotic fluid is less. That's why the foot become like that, cannot move easily in the tummy, in the uterus. So in this situation, due to mechanical stress, change the foot. Is it clear? In this, this situation called deformation, not malformation. It is deformation. When you want to refer the patient to the, for example, surgeon, to geneticist, to somebody else, you have to write the right form. Disruption. What is disruption? Disruption is when, for example, cord, fetal cord, when fetal cord close the feet or somebody, or hand or somewhere, and close and stick to hand, stick to leg or somewhere, and make close for blood supply of the hand or feet or whatever. So it makes some restriction for blood supply of the foot or hand or some other organs. In this situation, we have sort of, due to vascular infarction or mechanical force, we have abnormalities. When we have this sort of abnormality, we call disruption. Another one is displacement. Displacement is happen for legs. Femur. femur displacement. We have femur displacement. Here we have some sort of problem, tissue development in organ level. Here, the problem, or these, or other organs. In this situation, we have to say dysplasia. So we have four things: malformation, deformation, disruption, and dysplasia, as you can see here. This one has got not normal, abnormal development. Here we have, you remember, mechanical force. Here we have some sort of mechanical or problem with vascular supplement, vascular supportive of the organ, and dysplasia I explained to you. Okay. I said about single abnormality before. Now I am saying about multiple abnormality. Loud and fast in our language. That's multiple. For single we have a lot of problem. Now we have multiple. Means many problems together. Sometimes these abnormalities, multiple abnormalities, is one by one called sequence together. Sequence together. In this situation, one of that sequence is Potter sequence, a disease. Potter sequence is an example for sequence. Another one is what I am saying. I am explaining some sort of when you want to refer the patient, you need to know about terminology. I am explaining about terminology. You understand? Terminology of the malformation, terminology of abnormalities, and so on. One of the problems which you have a lot, with different, many problems together is syndrome. Syndrome is a set of medical signs and symptoms which are correlated with each other sometimes and associated with a particular disease or disorder, such as, Down syndrome. Down syndrome has got some problems together. We say Down syndrome. Another syndrome is Van der Wooden syndrome, which has got, you can see, cleft lip and also two point on lip. Long time ago, when somebody, a doctor, sees some sign together, put his name or her name on that syndromes, together. Say, this patient has got Ahmad Mahmad syndrome, for example. We don't have like that, but you can make it, doesn't matter. You see some sign and symptom together, you can say, okay, what's your name? Tahir? Yahya. Say, Yahya, you work together, what's your name? Jawad? Jafar. Say, Yahya Jafar syndrome. Because both of them speaking about collection of sign and symptom of a patient. You can do that, doesn't matter. Such as this one. Van der Wooden. Possibly it is from, you know which country is Van der Wooden?
German, Swiss.
No.
Dutch.
Holland, Dutch. Dutch. Holland. Yes, that's from Holland. Van der means yes, in our language, Zade, in Russian, off, something like that. So, you can put your name, but this is very important to know. when you say Van der Wooden, Jafar, I forgot your name. Yahya. Jafar Yahya syndrome. It means you don't know the cause. Understand? You know just the sign and symptom. You don't know the cause. The cause of the syndrome. Understand? You say, okay, cleft lip and some notes here say it is Van der Wooden, Yahya Jafar Wood syndrome, and so on and so on. But the reason is you don't know the cause of that. We have another terminology which is association. Association is very, very rare. It's not common disease. One of that is vectoral. Vectoral is these disorder together. This is association. These together is vectoral, is association. Okay. We gave you some terminology. Now I am going to say about the cause of them. Cause of this malformation. Most of the causes are genetic. 50%, 40%, something like that. And some of them are not genetic. They are teratogen or environment. I will explain to you. Chromosomal abnormalities or single gene disorders. You remember this morning I said cause of disorders are two, T to C mutations or chromosomes variations. Chromosome means part of the chromosome, many genes. So we have chromosomal abnormalities or single gene defect which may cause syndrome, association, or sequence, or single abnormality, or multiple abnormality, and so on and so on. Look at here. I classify malformation in different way. Classify malformation in different way. Classify malformation based on genetic mechanism is numerical abnormalities, structural abnormalities, and chromosome. Some part of the chromosome deleted, some part of chromosome insertion, and so on and so on. Structural abnormalities such as translocation, inversion, ring, and single gene mutations. I am classifying malformation based on mechanism. One, chromosomal, B, second one is mutation. Different numerical abnormalities due to mutation. Can you give me an example of numerical abnormalities? Chromosomal numerical abnormalities. Chromosomal numerical abnormalities.
There was one Clifton syndrome and
Very, very famous one.
yes.
What?
Down syndrome.
Down
Down
syndrome.
syndrome.
21 chromosome more. Is it right?
Yes.
Or Edwards syndrome. Edward. Or other syndrome, which is because of one deletion. Or, do you know Turner?
Yes.
Is deletion of one chromosome, X. Or Klinefelter,
Yes.
one X more. Understand? That's abnormalities due to numerical. Is it clear? Very clear. So, sometimes it's single gene mutations. Point mutation, insertion, deletion, or repeat. Do you know repeats? Exactly. Repeats, such as, for example, for repeats, Huntington. Huntington is different repeats. Or Fragile X is repeats. Okay. Genetic malformation according to inheritance. What I'm going to do now, classifying malformation. I am now classifying malformation. The first one was classifying based on mechanism. Now I am classifying based on inheritance. Exactly. Some of them are autosomal dominant, some of them are autosomal recessive. You know the autosomal dominant recessive. Am I right? Do you know?
Yes.
Okay. Autosomal recessive, X-linked inheritance, or mitochondria. Understand? It is based on inheritance from mother and father to the baby. Now I am classifying malformation based on phenotype. So we have developmental malformation or functional malformation. For example, cleft lip is developmental. Do you know? Because problem with development. Functional dysfunction is such as, do you know phenylketonuria?
Yes.
It's functional. Understand? It's malformation because it causes mental retardation and so on and so on. If you don't go for prenatal or newborn screening. Is it possible to divide or classify abnormality based on timing of occurrence? Timing of occurrence. Congenital malformation is exactly after birth. Exactly after birth. Acquired genetic change means after a long time. A specific genetic syndrome or syndrome caused by chromosomal abnormalities such as Down syndrome, Turner, Klinefelter, and so on. Syndrome caused by single gene mutation based on timing and occurrence. Okay. What I did, I gave you some, at the beginning I gave you some terminology about abnormalities. And after that, I gave you some cause classification of abnormality, single or multiple abnormalities. Now I am going to give you some examples. Example of genetic cause of malformation. I mean genetic one. Look at this one. That's Noonan syndrome. When I am saying syndrome, means Mr. Noonan, somebody such as Yahya or whatever, somebody called Noonan, long time ago, visit this person and say, okay, this sign, this symptom, this sign, this symptom together is Noonan syndrome. Put his name on there. These sign and symptoms, set of sign and symptoms. But at that time, they didn't know. Cause of this symptom is problem in this pathway. You know pathways? This is a gene, KRAS, and work on this one receptor, and this one work on this gene work on this gene work on ERK gene, and then go to some other function. Is it clear? Okay. So, if we have problem with this gene, or this gene, or this gene, or this gene, they cause Noonan syndrome. Is it clear? Now we know the cause of the cause of Noonan syndrome. Understand? At that time they didn't know that. But now we know the cause of syndrome is, for example, possibly this gene, possibly this gene, possibly this gene, or possibly PTPN11 gene. Understand? Mutation in this gene can cause Noonan syndrome. When Noonan was living, we didn't know, but now we know. So you can find the cause of the syndrome. And anyway, another, for example, you can see that person is a little bit different with another gene here. Look at this one. Many, 6 different Noonan syndromes with different genes, different causes. Is it clear? With different genes can cause one syndrome. Another disorder, another abnormalities, another malformation is Soto syndrome. Mr. Soto, I don't know Soto. I think he was from Japan or something. I suppose this is Japanese name. That's the Soto syndrome. You can see the person. At that time, they didn't know the cause of this one, but now they know problem in NST1 gene or NF1, NF9 gene can cause Soto syndrome. Understand? At that time they didn't know. How they know? After NGS. Because they can sequence the person and see and compare with normal. You understand what I mean? Sequence the person, patient, and compare with normal. You find, oh, this is the problem. Another one is cause of malformation. Another example is Costello syndrome. Mr. Costello, I don't know, maybe from Spain or I don't know, Portugal, somewhere. Costello is caused by a gene which is HRAS gene. At the time of Costello, they didn't know about the cause. But now, every day we can find about the causes of syndromes. Is it clear? Understand? Such as this one. Cardiofasciocutaneous. Fascio means skin. Cardio means heart. And cardiofascio and cutaneous means the skin. So fascio means face. This person has got problem with face, skin and heart. Somebody called syndrome. Now we know the problem is due to BRAF1 gene mutation. Understand? Day by day, months by months, we can find discover the cause of syndromes. Is it clear? Okay. What I said about malformation, cause of malformation, different malformations such as syndrome and so on and so on. Now I want to explain about one of the most important part of the malformation, especially is very important for women, for mothers, not women, mothers. Do you know why?
Why?
Do you know neural tube defects?
Yes.
Neural tube. It can be such as this one, very, very serious, or even just hairy, very small one. You can check the baby and you see a little bit hairier. Don't say, oh, doesn't matter, it's nothing, but it is maybe serious. Usually is between second and third weeks of gestation. It's the time, very, very important time, which I'll tell you later. Anencephaly or different sort of malformation you can see here. You remember this one? This morning I said, do you remember I said about thrombophilia?
Yes.
One of the genes was about thrombophilia was MTHFR. Teratogens later took us. As I said to you just this morning, polymorphism in this gene is very high. It's very high. What happened? What happened with this polymorphism? Do you know why? What happened? What happened? What this gene related to?
Neural tube defect is mainly due to B9 deficiency. So probably there is some changes in folate.
Folic acid. Yes. Look at this one. Related to vitamin B12, related to folic acid, related to methionine, related to homocysteine, related to cysteine, and many things. So it can cause many disorders. And polymorphism of this gene in middle is very high. What happened? What do you do as a medical doctor?
Prescribe vitamins.
No, prescribe
Folate.
folic acid. Yes. When mother during the pregnancy, we have to give to mother folic acid. Do you know why? Because we don't know about the polymorphism. Doesn't matter. You prescribe folic acid. Do you know why? If you give the folic acid more, it doesn't matter, because folic acid is a vitamin solvent in water, dissolved in water. Not like vitamin A, vitamins D, vitamin E. They dissolve in oil. But folic acid dissolve in water. So if you give overdose more to mother, what happens? Secreted to urine. Exactly, secreted to urine. So it doesn't matter. In Iran, I don't know in your country, in Iran, usually we prescribe just blind 5 milligram folic acid for everybody who is pregnant. Sorry?
Iraq also.
Iraq also. Do you know why? Because we don't know about polymorphism of MTHFR. Just blind. But better than nothing. Understand? But better than nothing, because you don't know. If you have problem with this one, you have neural tube defect. You have problem, fetal neural tube defect, poorly pregnancy outcome, recurrent abortion, colorectal cancer, and many things. But when you give just blindly folic acid. Now you understand why during pregnancy they give folic acid. Understand? Because of this gene. Polymorphism of this gene. Is it clear? Okay, I said about genetic causes of malformation. What I said, causes of malformation. I gave you some information about genetic causes. Now I am saying to say something about environmental, teratogen, and some unknown. I cannot say something about unknown. When we say about the environmental agent means teratogenicity. What's teratogen? You know, terato means terato. What's terato means? Monster. Monster. Teratogenicity means monster, because long time ago when baby born with malformation, it was some dangerous. So like, do you know monster? They say this is monster, the baby is monster. So in this situation called teratogen. So teratogen, any agent or factor to which fetal exposure produce a permanent alteration in form of function of the offspring means teratogen. Do you understand what I mean in point of teratogen? Okay. It can be substance, it can be anything. Terato in Greek means monster, and teratogen in pregnancy. Which kind of teratogen do we have? I classify all teratogens here. Teratogenicity categorized into several groups. One, environmental factor, can be chemical. I explain all of these. Infectious agents, radiations. Second is pharmaceutical or maternal health, mother health, and nutrition deficiency or excess. This is the classification of teratogens. You must know these two slides. You must know these two slides. Very important, these two slides. Just explain some of them. Now I'm explaining some of that two slides. Drug and chemical. Drug and chemical such as thalidomide. Do you know thalidomide? During the Second World War, they used to use antidepressant which called thalidomide. It was the first teratogen they found. I mean, this one. And because when mother used thalidomide, the baby born without hand and legs, without that. In this situation, they found teratogens from thalidomide. Thalidomide was the first teratogen drug which can cause abnormalities. Do you know alcohol? Can cause some sort of abnormalities. Fetal alcohol syndrome. Do you know the syndrome, the meaning of syndrome? Syndrome means some symptom and sign together, called syndrome. Symptom and sign together, called syndrome. So for alcohol, we have some. This is the normal day, and look at that one. That's fetal alcohol syndrome, and many other things. To be honest with you, alcohol syndrome is sort of iceberg. Most of the problem you cannot see. So fetal alcohol syndrome is serious. You as a medical doctor, unfortunately in Iran also, this one is increasing. You as a medical doctor, for sure, tell to your patient they don't use alcohol when they are pregnant. When they are pregnant. It is very important. Very important. Don't use alcohol when they are pregnant. And not only alcohol, even illegal drugs, gold, cannabis, different cocaine, heroin, methadone, many other drugs. Definitely they are illegal drugs, they are teratogen. They are teratogen. I am saying many times. They are teratogen. So during this time we don't use that. I want to emphasize to you, have you seen the brochure of the drug? Any kind of drug,
Yes.
antibiotic and anything, always, not often, always in the brochure one part is the safety for pregnant people. Understand? Always in the brochure is safety for pregnant people. You must check it. Many of the drugs are teratogen in different levels. Some of them, such as vitamin A, high dose of vitamin A. For which disease you use it? Do you know? Do you know Roacutan? You don't know.
Night blindness?
For
Night blindness?
Roacutan, no. For acne. They use for acne. That's vitamin A with high dose. Do you know it is very serious teratogen?
It causes microcephaly.
Yes, medicine, not just that one. Because it is teratogen. So when you prescribe drug, check it out. Or even you want to use, especially for women who are pregnant, they have to check that. What's another thing? Torch. Do you know torch? Torch is some infectious, viral infections, bacterial infections, parasite infections, together called torch. Torch is brief of toxoplasmosis, other infectious, rubella, cytomegalovirus, and herpes simplex. The brief of this, and it can cause many problems in the baby, in the fetus. Is it clear? We say okay, but it is very difficult, very difficult to manage. Do you know why? Do you know how? Because they bring a baby with anomaly. You don't know during the pregnancy mother has got rubella or not. You know, it's 4, 5, 6 months ago. Mother cannot remember. Rubella is like a influenza. Rubella is like influenza. How do you change? It's very difficult. It's very difficult. For example, during, usually, I say to pregnant people, during pregnancy, don't play with cat. Do you know why?
Yeah.
For what?
Because of the-
Exactly. And many other things. So it is very difficult to manage that one. Do you know what's the difference between IgG and IgM?
Yes.
What's the difference? IgG and IgM. When IgM is high, means recently has got cytomegalovirus, for example. Recently. If IgG is high, means long time ago got CMV or the vaccine. Understand? Understand? Is it clear? Okay. So, how do you check this one? With checking immunoglobulin or checking by PCR, check by PCR. So I said it is difficult to check the different infectious. Okay, let's back to the environmental agent and teratogens. Physical agent, such as one, physical agent. Prolonged hyperthermia, ionizing radiation. Is it possible? Radiation.
Yes.
Radiation. Is it teratogen?
Yes.
I don't say it, you say it. Prolonged hyperthermia. What is that?
Being cold for
Hyperthermia.
being hot for a long time.
How? When?
During summers or
Somebody go
Heat stroke, for example.
sauna.
Mm.
You are pregnant. Don't go to sauna for a few months. After that, go. Understand? Sauna. Sauna. You know sauna? That's it. So, we have to be aware of these. Mental illness. Is it important? Mental illness?
Yes.
Diabetes of mother, phenylketonuria of mother, maternal epilepsy, malnutrition of mother in Africa. I don't think in our country is happening. Maybe. Malnutrition of the mother. And maternal age of the mother. And also stress. Maternal age of the mother and stress. It is, stress can be a teratogen. How? Stress. Tell me how.
maybe because we release a lot of cortisol.
Exactly one of them. And many cytokine. Many different cytokine. And also cortisols. Exactly. Diabetes of the mother makes diabetic syndrome. Diabetes of the mother. you must memorize this one. It is very important. This one. It is very important stuff. Very, very important. Why? This is the week of pregnancy. What time is ovulation? What time is the ovulation?
14 days.
14 days before
Period.
period. Exactly. 14 days before period. If somebody become pregnant, what happened? If somebody become pregnant 2 weeks before period, so in this period of time, she doesn't know she is pregnant or not. Am I right? She doesn't know. Two weeks. Is it possible to do 2 weeks after that? Doesn't care, because sometimes period is not exact time. It's irregular. It's not regular. It's irregular. So 2 weeks, nothing. 2-3 weeks after that, they don't care. They don't care. But she's pregnant. She's pregnant. You understand what I mean? She's pregnant, but she doesn't care. Look at this time. Look at this time. 2 weeks, nothing. The weeks after that, the weeks after that, the weeks after. If she say, okay, no, I am not pregnant, it is irregularity, I have to wait for 1 month later, 2 weeks, add 4 weeks, it's 6 weeks. Here, look at this. Look at this. This one, this color is very high sensitive to environmental things. This stage. This is the development of fetus. Look at this one. Gut, lower lip, upper lip, eye, ear, heart, vertebral. Do you remember nervous system defect? You remember?
Yes.
She doesn't know she's pregnant. She go to eat hot dog. But you don't know what is in the sausages. Many. I don't know. I cannot say because I have seen that. A lot of garbage, I say. Okay. Oh, eat the sausages. Do you know what happened in this period of time? What happened? Look at that. Central nervous system. Is it possible this material pass through from uterus to the fetus? Do you understand the meaning of importance of teratogenicity? Okay, I said to you. So this part of the fetal development is very important. Understand? But here is not important. Look at it this way. Because that's organogenesis. Means the baby, the fetus has got hand and so on and so on and so on. The development is just the size. You get that? Development is just the size. Not hand. Look, if something, do you remember thalidomide?
Yes.
If you have thalidomide at this stage, there is no hand, there is no legs. Understand? Is it clear? So, this is very important to know. factors that determine the effects of teratogen is dose, exposure, duration. If you go for radiation, they take a picture. It's just only one. But if you are the worker in the radiology, which one is more important? For the worker, when the worker is pregnant, or a person who got a one picture? Worker. Because every day is duration of exposure. Understand? Exposure between one picture or CT scan. Which one is more important? Of course CT scan. CT scan is 100 times than one AP or lateral chest X-ray. Understand? Okay. So you must know about this slides too. Important points regarding teratogens include timing of exposure, type of teratogen, dose of and duration of teratogen, and genetic factor. Genetic factor is also important or not? Do you remember I said many times today about polymorphism? Many times. Sometimes I have a polymorphism, a protein can repair our gene, repair our mutation, somebody doesn't have. Understand? Okay, the last one is twin. How many kind of twins we have?
7.
Very nice.
Two.
To be honest, I wish I had twin, but I don't. I like twin very much. Twin is nice. How many kind of twins do we have?
7.
Two. One is
Identical.
one is monosomic. Second is
Dizygote.
what's the difference between these two?
The
Monozygotic or identical.
Monozygotic is from
One zygote.
one zygote, and dizygotic is from
Two
two.
zygotes.
Monozygotic makes two identical twin, and dizygotic makes exactly like two persons, a boy, a girl, two boys, two brothers, two sisters. But this one is 100% genetic similarity, this one is 50% similarity. Is it 100% similarity? I don't believe it.
99.
No, 100%. But 100% for which kind of DNA? How many kind of DNA do we have? How many kinds of DNA do we have in a cell? Tell me please. Tell me please. How many kinds of DNA do we have in a cell?
46.
Two kinds.
Maternal, maternal.
No. Oh, I killed myself. No. No.
Type A and type B.
No.
Next type is Z.
AT.
Nuclear DNA,
And
which is chromosome 1, 2, 3, 4. Nuclear DNA and, higher. Mitochondria. Exactly. Mitochondrial DNA. Nuclear DNA and mitochondrial DNA. Identical twins, they have the same, which DNA?
Nuclear.
Nuclear DNA. Absolutely the same nuclear DNA. Is it the same mitochondrial DNA? Maybe not. Maybe not. Understand? Maybe not. But nuclear DNA is the main DNA in our body. Mitochondrial DNA is very, very less compared to that. Understand? But anyway, it is a DNA. It is a DNA. It is a question just for exam because it's a little nitty. Naughty. You know naughty? Naughty question. It's naughty question. Okay. Twin study. What's importance of twin study? What's importance of twin studies? What's importance of twin studies?
Java instead of twin.
You are twin?
Yes.
Identical?
No.
I like identical. I wish to have, but not. What's the difference between? I said identical twins, they have the same DNA, identical. If one identical twin live here in Iran, another live in Iraq, in Africa, in USA, in somewhere else, is it possible to check influence of environment
Yes.
on genome? Yes. For example, do you know MS? Do you know MS? Multiple sclerosis.
Yes.
Is it genetical or environmental? If you see two identical twins, one has got MS, another one doesn't have, it means environmental or maybe genetic influence, or it's not pure genetical. Understand? It's not pure genetical, it's not pure environmental. Understand? It is, identical twins, they are very important for genetic and environmental influence on traits. Is it clear? The red one?
Yes.
Is it good?
Yes.
Of course it is, especially with NGS and so on and so on. When we have, we can publish many papers, many with this one. This one is, which, is it identical?
Yes.
Because it's one and this is disomy. It's not identical. You can see here, disomy, this is identical. Identical can, very important to know about identical time. Look at that, the first to third day is two different identical. But when it is 4 to 8, they have the same coding. With this one, 8 to 13, the time of gestation, the time of the development, they have one such. Look at that, one such. They have two such, one chorion. They have one such. And after 13 to 15, what happened? Division of, what's the origin of identical twin? Separation of stem cells. Stem cells. Each stem cell can cause one baby, can make a baby. So, separation of the stem cells. If separation happened in the day of 1 and 3, 4 and 8, 8 to 13s, and after 13s, look at this. They cannot separate it completely. Make twin, but not separated. Can you see? And the results of that, non-separated or conjugate, conjunct twins. Look at this one. and different. The results of that this one. I know. Have you seen that one? Or no?
Yes.
Yeah, you see. Look at it. Sometimes this is Trachopagus. Trachopagus. Is that one? They have two heads. Trachopagus. Sometimes they have one head, such as this one. Craniopagus. Cranium. Tracho. You know that. Cranium, that's Lale, Ladan. It was in Iran. When they try to open this one, they die. Ladan, when they open this one, they die, both of them. The main one is Tracho, Pagus, and Zerti of this one. Have you seen this one?
Yes.
Yes.
No, I haven't seen that one. Just a picture. That's parasitic. It's very, very rare. Very, very rare. Parasitic. But conjoint. Any question?
No.